Dr. Sabina Lim. I'm the Vice President of Behavioral Health for the Mount Sinai Health System. The COVID-19 crisis is unlike anything we've ever experienced. For our patients or anyone who struggles with anxiety, depression, PTSD, or substance abuse, these feelings can be really heightened right now, and you may be finding it really hard to cope. Even people who don't normally experience mental health issues can find themselves wanting to see a professional who can help them through the life challenges we are facing. My team is here to help you with these and other mental health issues. Whether you're an existing patient or newly seeking treatment, please do not put your mental health care on hold. It's important you get the support you need when you need it, from routine appointments to emergency services. Of course, we understand that you may have concerns about returning to a doctor's office or to the hospital due to safety. Please be assured, though, that our psychiatrists, psychologists, social workers, counselors, nurses, and all of our wonderful staff are working diligently to ensure the health and safety of each and every patient who depends on us for care with rigorous protocols in place. All areas of the Mount Sinai Health System are rigorously disinfected, including our outpatient waiting rooms, our inpatient rooms, and all high-touch surfaces. Inpatient rooms receive a ceiling-to-floor cleaning after a patient has been discharged and before a new patient is admitted, which takes approximately 2 hours and includes several quality assurance checks. In our outpatient practices, we have set up our spaces to comply with the 6-foot physical distancing requirements, and high-touch surfaces such as doorknobs and kiosks are continually cleaned. Staff are monitoring themselves too for signs and symptoms of COVID-19 twice daily and being tested for exposure to COVID-19. We will call you prior to your visit to ask if you have COVID-19 symptoms. To reduce your wait time and contact with others, as much of your check-in as possible will be done electronically before you come in. All patients will be screened for COVID-19 symptoms, including temperature checks. Patients showing symptoms will be referred for appropriate care. Throughout your visit at Mount Sinai, all patients and staff are required to wear face coverings, as well as appropriate protective equipment. Patients and visitors will be provided with a mask, if needed. We are following the New York State guidelines on visitor restrictions. Please visit our website at mountsinai.org for the most up-to-date information. During your visit, there's no better time to emphasize the importance of hand hygiene. We recommend that you wash your hands with soap and water for at least 20 seconds frequently. We also will make alcohol-based hand sanitizers readily available for our patients and staff throughout our health system in case you don't have access to soap and water. We're minimizing contact between patients by spacing furniture, minimizing the number of patients in waiting areas, and scheduling more time between appointments. We have offered our patients telehealth visits using phone or video during the COVID-19 pandemic, and this option has been very successful for many patients. We will continue to offer these convenient video and phone visits for as long as we are allowed, so you get the same skilled and compassionate care that you would in person. We care about you, and we want to help you take care of both your physical and mental health care needs as safely as possible. If you are an existing patient, please contact the main number of the program you have already been attending to make an appointment. If you're newly seeking treatment services, please visit our website to find the best phone number to call to best meet your treatment needs and location. We look forward to seeing you soon.